Hi everyone, and welcome to another Psych student video. Today we're thinking about how people develop symptoms of psychosis and what the risk factors for psychosis actually are. Now, when we talk about psychosis, what we're meaning is the symptoms, and that can develop because of lots of different reasons, and we'll talk about a kind of timeline of multifactorial issues that feeds into that and the risk factors that can affect us throughout life. Sometimes there's a specific trigger, maybe a stressful event or use of drugs, but not always. Sometimes it develops gradually over time. When we think about psychosis, what I'm referring to here is the syndrome of delusions, hallucinations, thought disorder, and those kind of group of symptoms really, rather than a specific diagnosis. When we do have those symptoms, we can then think about what has actually caused them and what the diagnosis is. But when we're thinking about risk, we're thinking about the risk here for those symptoms to develop. And it might take time to then confirm the diagnosis, which happens later on. That might be schizophrenia, could be to do with drug use, maybe a drug-induced psychosis, could be an infection or a physical health cause that's given kind of delirium symptoms of psychosis. Or it could maybe be an affective component, so it could be psychosis within bipolar disorder or schizoaffective disorder. What we're thinking about here is more that kind of prodromal phase, so that's the development of those symptoms and the risks that might push someone from maybe not experiencing psychosis into an actual psychotic episode. So this is the timeline that we're looking at, and this is pulled from a paper in the British Journal of Psychiatry Advances. And what we're going to do is go through each of those different phases. So it starts prenatal issues before the person is even born. There can be things that contribute to your later risk of developing a psychotic type of illness. And that kind of goes through. So we go through each of different phases, the birth and childhood, later childhood, adolescence and adulthood, and all that then feeds into our neurological, neurochemical outcomes and the impact of inflammation. So firstly, then you're looking at the genetic factors. So here we've got SNPs and CNVs. They're types of changes and deletions within genetic material. An example of this, which is most well known, is something called 22q11.2. And that is known as velocardiofacial syndrome or DeGeorge syndrome. And that's a deletion which results in an increased risk of psychosis. There are loads and loads of others, and there's not one specific kind of psychosis gene. There's loads of small things that can contribute when built up together. There's also factors around pregnancy. So for some people, there have been lots of studies around kind of the age of parents when they conceive. There could be maternal exposure to pregnancy traumas. So, for example, there's been investigations of big stressful events happening during pregnancy and the impact that has on the developing fetus itself, and maybe kind of insults to the brain throughout. If there's difficulties with the birth itself, it might well be that the risk is increased. Looking here at kind of early illness and development, there might well be difficulties with infection in childhood development, and maybe metabolic disorders as well, which can feed into those difficulties. Throughout the whole of the timeline, really, there's lots of different biopsychosocial factors, and here we're looking at nutrition, the living environment, so if there's kind of any stresses, traumatic experiences, abuse, communicative environment. For example, difficulties in communication between parents and children have been linked to later development of psychotic disorders. However, there is some evidence for a shared genetic vulnerability towards maybe communication difficulties, which might affect both the parent and the child. Traumatic experiences and big stressful events in particular have been linked to later development of psychosis symptoms. And moving house multiple times, disruption in your social environment has been linked as well. A big factor to consider here is going to be the role of stigma. So actually evidence suggests that the stigma related to being labelled as at risk for psychosis, maybe in that prodromal period or later on when they're experiencing symptoms of illness, can both feed into developing other kind of comorbid problems, so anxiety and depression. And the psychotic symptoms, while stress is a risk factor for their development, also cause a lot of stress in themselves. Substance misuse is particularly interesting when we think about the risk for psychosis, because at times it's been quite controversial. Now, cannabis particularly has been investigated, and overall it does seem that this does increase our risk for psychosis type illnesses. But also it might well be that people are using cannabis more when they're experiencing symptoms to try to cope as well. So there's lots of different kind of ways of looking at this. Alongside cannabis, there's obviously lots of other substances. So cocaine is a big one that causes problems, and amphetamines. And then other substances, things like LSD, ecstasy, ketamine can trigger some psychotic symptoms as well. And some of that may link in with sleep disturbance, which we know is highly prevalent among people with, for example, schizophrenia. And sleep disturbance in itself can be a really key prodromal symptom. So when we come to the end of our timeline, then all of those factors that might have impacted people throughout life, now clearly not all of them are going to impact every single person, and everyone's going to have a different pathway, but it comes to kind of key mechanisms at the end, and some of that's neurochemical, so the dopamine pathways, but also glutamate and cortisol, which is a stress hormone. There's pathways to do with inflammation, with evidence describing different cytokine profiles within the immune system for people that then go on to develop psychosis illnesses, and specific syndromes such as the NMDA antibodies, which can cause a type of autoimmune psychotic syndrome. And within that as well, there's the neurostructure, so the actual physical changes that happen in someone's brain throughout the development of psychosis. And it might well be that there's differences, particularly around abnormal plasticity, that develop. So thank you very much for listening. I really recommend checking out the full paper to better understand this topic. Thank you.